Welcome back to Why We Nurse. I'm your host, Serena Tobar. Today, we're doing something I absolutely love. We're spotlighting the lived experience of a nurse whose career has taken her across multiple settings. Our guest today is Patty Allison, an LVN whose journey includes acute care, pharmacy clinic, rehabilitation, corrections, and home health. That's a range most people don't even realize is possible within vocational nursing. And each setting has shaped her practice in powerful ways. This conversation is about versatility, resilience, and the unique lens LVNs bring to patient care. Let's jump in. So, Patty, thank you so much for being here today. I'm excited for this conversation because your career path is a beautiful example of how dynamic LVN practice can be. To start us off, can you introduce yourself and share a little bit about what first drew you to nursing and specifically becoming an LVN?
Hi, Patty Allison, LVN. Been an LVN for 17 years across multitude experiences. I was drawn to nursing because I myself was a patient at a very young age. And as a nurse now, I can look back and see some positive things of my experience and some things that could have been better. But I think that personal experience gives me some insight into the patients and managing recovery, pain, things like that.
So, can you talk a little bit about your experience working as an LVN in the acute care setting? Maybe what a typical day looks like for you, and what did you learn about yourself as a nurse in that environment?
Going into acute care was much later in my career. I had been a nurse for over 10 years. It was during the pandemic. And so everyone was trying to get nurses on board. Everyone was burnt out, seeing things, mentally, emotionally, not having the opportunities to be with their families and things that help us feel better as people after these long shifts. I had the opportunity to work on the acute care floor under the RNs. They totally transformed the way I kind of looked at nursing and some of my experiences because I had not done a lot of hospital work prior to that. It was a cohort of 6 LVNs, I believe, at one of the major hospital systems here. We were at one of the satellite local hospitals, not the main downtown medical center, but I think it was utilized across the system. A cohort of LVNs that come in, we were trained in EKGs and things that kind of put us at the top of our scope of practice. Of course, there were limitations to maintain our scope. There were certain cardiac drips and things that are not part of what we are able to do. And so, although it was a critical care unit, it was not ICU, they were not intubated, but really had the opportunity to learn and grow myself and the other LVNs in this cohort. I was doing some schooling online, hoping to get into nursing school and get my BSN. So the idea was really growth and kind of shaping LVNs as they blossom into that RN role. Patients were on continuous cardiac monitoring, multiple drips sometimes. But like I said, we had to limit within our scope. So I learned a lot about heparin, some of our disease processes, the cardiopulmonary system. It was just both challenging and incredibly exciting. Probably one of my favorite roles,
Mhm.
and something that definitely pushes me to want to finish out that BSN and continue to grow as a nurse.
That's exciting. So, you also have experience in a pharmacy clinic. And I'm just curious, can you tell us a little bit about what that looks like?
Quite different. Obviously, not 12-hour shifts. You're very in the public. And so you meet lots of people and try to do a lot in a very short amount of time. It is my first experience with actually managing tasks that nurses usually don't with insurance, running insurance, understanding different types of contracts, Medicaid, Medicare, what you are and aren't able to do based on certain rules. It's also interesting how many folks are without health care and that healthcare is so out of reach for so many people because of the expense of it. And that's, something you don't take into consideration when you're not running insurance. And at the bedside, you are holding their hand during the absolute worst moments of their lives or consoling family members, because they're terrified of what's going to happen next. And you have to have a deep understanding of, humans and relationships and things like that. And in a clinic setting, you are very fast paced, you're very to the point, and you don't have that opportunity to connect with your patients as much. You don't spend 12 hours with them, you spend 10 minutes with them. And there's a lot to do in a very short amount of time.
And you brought up a really good point about the access to care. So I imagine you may have had some people who that 10 minutes was their primary care.
It does offer primary care as well as immunizations, sick visits, things like that, which is incredible that primary care is changing so dynamically and offered in, many different settings, not just your typical 8 to 5 doctor-led clinic with some of the different health systems because you don't consider a pharmacy when you're considering a health system. You consider all of your major hospitals.
When I think of a pharmacy clinic, I think of like I'm going to get maybe a vaccine, maybe a flu shot, or maybe a booster for like my Tdap or something like that. I don't think about receiving primary care in the clinic. So that's an interesting aspect of that. And I can honestly say I have never ran insurance, nor do I ever aspire to.
It is as complicated as someone in the medical field as it is for someone, I consider myself a fairly lay person when it comes to medical insurance because it's not something I know the intricacies of. And it was definitely one of the challenges with this role.
Let's talk a little bit about rehab nursing because this requires a lot of patience, some encouragement, and definitely a lot of emotional presence. So, what was meaningful about your time in rehab, and how did that shape the way you approach patient progress and recovery?
My rehab experience inpatient came after my home health experience. And in my personal recovery journey, I was a homebound person. And so the rehab aspect of it was very limited. And you only had someone come in several times a week. They spent maybe half an hour with you, and you continue to progress towards your goals, but very slowly. On the inpatient setting, it is very similar to a hospital, and everyone has to have their chronic care medications and things first part of the day. There is lots of coordination between physical therapy, speech therapy, occupational therapy, the nurses. You really consider pain management because you want to encourage patients to participate and you don't want to hinder them. So you have to provide pain management in a timely fashion, but also coordinating with other practitioners and how their day is going. And one tiny domino can change the rest of the course of the day for one patient. And sometimes if it's a practitioner, that something occurs, it can really hinder the rest of their day with each of their clients. There was 6 to 8 patients on the inpatient aspect in the rehab setting. Unfortunately, that made it very challenging because not everyone was one minor thing that they were trying to rehab. Sometimes they required a lot of assistance getting up, toileting, doing activities of daily living, and getting them ready for the day. And when you have to have that pain management on board and coordinating with other staff, that takes time to communicate with them. Knowing what doctors are rounding each day is also important because they each have their own schedules and you want the patient to be in the room during those times. And so it's an opportunity for nurses to look at patients as a whole. And that's what puts us in a different aspect than other practitioners, as we have the opportunity to look at patients as a whole and look at all these aspects that affect their care and their recovery, coordinating with not only time, but what are their goals? What have they accomplished? So if you're looking at a patient who has an occupational therapist and part of their therapy is learning to brush their teeth and do things like that, understanding what skills they have accomplished and which ones they're still working on gives you an opportunity to encourage them to practice those things. So it's very intimate and intrusive for the patients to have everyone else kind of having hands in their life, but also an opportunity to make immense progress because they're doing so many hours of therapy every day as required by insurance in order to stay in that rehab setting.
I love that perspective because when we think about it, nurses see the long game. And so in the rehab, you're looking at each little win. Like today, they were able to brush their teeth. Tomorrow, they're able to brush their teeth, brush their hair, and wash their face. So all those little small wins add up to the big victory at the end.
Absolutely. And that's the difference between a patient going home in 6 weeks and requesting more time for that patient. And so it requires a lot of critical thinking, a lot of coordination, a lot of time management. It's mentally and physically demanding.
And so you mentioned that you were in home health, which is something I can relate to because I did home health for a long time. But I would like for you to tell our listeners what did it look like when you did home health, and how did that shape your perspective when you're caring for patients in their environment versus them coming to us?
Uh, you definitely kind of have to walk on tiptoes because, like you said, you are in their environment, you're in their home, and they have a great deal of respect for you coming to them. And so it's very humbling to not be able to leave your home, to not be able to do things that as an adult we're not cognizant that we're so independent until we're not. And so you have to have both that respect for their environment, respect for them as patients, and kind of meet them halfway because you are in their environment, but also you are there to complete a task. You want to be timely to respect their time, but you also want to be timely to respect the next patient's time. Houston traffic doesn't make that easy. Sometimes patients' homes are not close together. And so planning your day, understanding traffic patterns. Who knew, like as a nurse, that's something you would need to really consider that at 3 o'clock in the afternoon, you don't want to go through multiple school zones. You don't think about that at the bedside or if you're working from home or other aspects. You really have to take into consideration their time and their space and respect them as a patient and, also meet them as a nurse and show up on time, be professional, know what it is you're doing, what you're there to do, what you're looking for, have an understanding of your patient's comorbidities and things, what may prevent them from doing task or from understanding learning if that's your task that day, making sure there's supplies either in the home, ordering the supplies to be sent to the home. So you really are managing several aspects of care that you don't consider when there's a supply closet available or a cart to take for wound care. You have to be prepared, and you have to be prepared for everything because you don't know how that patient's going to present. You don't know if they had a rough night. All you know is that you talked to them yesterday and confirmed a time and you try to show up in that very short time frame.
There's also other aspects that I don't think that nurses who have not done home health really consider. And while you do have some family dynamics that play out in the hospital, it's very different in home health. You have the family dynamics. You have some barriers that you have to go through, and it can be challenging, especially when maybe the home is not kept in a manner that is conducive for wound healing, not an
Absolutely.
environment that you wanna store sterile products in. Sometimes that can be challenging, and you have to get creative.
Y- You do. Um, you have to be prepared for that. Um, PPE is important, making them maybe your last patient of the day so that you're not carrying that to the next patient's home. And again, sometimes it's not easy based on your patient load, location, things like that to make them the last patient of the day. So again, if storing things there is not an acceptable thing, you have to, like you said, be creative and have something you specifically store their belongings in and only carry in items that you're not going to remove from the home. And so you have to be prepared for what the wound looked like the day before or the previous time it was seen and understand that you may need more supplies because it's been more saturated lately. Or, like you said, you get creative and sometimes store a few things in a Ziploc bag or teach a certain way or um, educate about cleanliness and how important it is. And like you said, there's many different aspects of that. And you have to balance yourself with those family dynamics, different people in the home, how they're receptive to teaching certain languages, what their understanding of it is, and lots of things to consider when you are meeting that patient in their environment and their environment is not conducive for, like you said, wound healing. And also reporting that back to the physicians.
Mhm. Yes,
And,
exactly.
do we need to do cultures more often? Do we need to make considerations of certain things? Um, are there resources out there that we can provide to them to assist with cleanliness? And you just have to think on your toes, but also think of all aspects of it.
I totally agree, and you have to think about your safety, but it can be very rewarding because sometimes you get to know these patients for months, for years. You get to know their families, and it can be a very rewarding experience.
Absolutely. I don't think I've had a nursing role that hasn't both taught me something, but also been incredibly rewarding.
So let's talk a little bit about corrections because this is where I'm like super interested. I've always said I feel like I'm too nice of a person to work in corrections, and I'm probably completely wrong with that thinking because I have taken care of prisoners, but I taken care of prisoners in an acute care setting. But I'm very interested to hear about your corrections experience.
Interesting is a wonderful word to describe it because I find myself to be a nice, caring person, and I don't know a nurse who isn't. And you have to be astute to the type of environment that you are in. No matter whether you're in home health, if you're in the hospital setting, if you're in corrections, you have to be aware of possibilities, unfortunately, because crimes can happen anywhere. Patients can have mental health issues anywhere. And my time in corrections it was not a long-term facility. Some folks were awaiting sentencing, some folks were there for a short time, and some folks were there for many years. And anybody can commit crimes. People can be from all walks of life, have all sorts of different life experiences, and you have to treat every single person the same. You have to treat them with dignity. You have to understand that they may be dealing with many things outside of being stuck there, and that they have nothing but time to think about things. You know, at the end of the day, we go home and we're thinking about dinner and traffic and all of that. And when you are incarcerated, someone is planning your meals. Someone tells you when it's time to rack up. Someone tells you when it's time to go outside. And depending on which level, you may be in a single cell by yourself. You may be in a population of people who are from different walks of life as you. And each of the patients in the jail are experiencing different things. But just like all of us, they're stressed about things. They just have absolutely no control over everything going on outside of the jail facility that you're in. And so they think about these things, and you have to help them kind of stop ruminating, stop those thought processes if there are stressors or underlying mental health, and say, I'm here to help you with this problem. You've complained of this problem, or you still treat chronic care. You still address, we called it triage, if they have some sinus issues going on, or anything that the rest of us would walk into a pharmacy and handle on our own, they have to ask for assistance. And so they have a lot of independence removed from them. And there's items they can purchase on commissary, but not all items are available. And many items require to be passed during medication passes, while some items are acceptable within the confines of their personal space. And so that varies from facility to facility on what their rules are, what they're able to have, what they're not able to have, and how much of it. If it's something they can purchase on their own, my understanding was they could have as much as they were able to purchase within those means or timeframes, whatever the rules or stipulations were for that. However, you can't have 200 ibuprofen laying around. It's dangerous. Someone else could get a hold of it, things like that. So that's a simple medication we probably all have in our medicine cabinet, our purse, our car, anywhere. It can be very difficult to have an issue like a headache that each of us would address individually without telling someone about it, without going through these intricacies. And we would take our ibuprofen, and if it persisted, we would manage it accordingly, right? We would go see the doctor. Within the confines of correction, they are told what the next step is. They are told how we're going to do it. We're going to treat it this way. And then, per our protocols, we're going to do this. Or it takes several sick visits before you can go see the dentist or the doctor or things like that. And so many of us, if we had a persistent problem, would schedule that appointment on our own. And I think that when we consider what our patients are going through and what they've potentially been through, you still have that heart for nursing. You still have that kindness and consideration. You just understand that you can't be a pushover. You can't allow folks to be disrespectful. You have to set very strict, rigorous boundaries, but also hold that same boundary for each person. You know, you can't have a boundary with one person and not someone else, or treat someone one way and not treat everyone that way. So, um, It's very you have to be conscious of how you are presenting yourself, how you are handling yourself, maintain those boundaries, and also maintain your practice.
Is there any misconceptions about corrections nursing that you would want other nurses to understand better?
It's not as scary and as dangerous as you think. You're not being left alone with people. You're not all in the same place. There are cameras absolutely everywhere. Every move you make, you count the sharps, you count narcotics, you count everything. It is a very strict environment to be in. You still work with doctors just like you would in any other clinic if you're in the clinic setting. If you do have to go into the housing, there is typically some sort of medical station or room set up in which you can perform things or bring a cart with you, or depending on how the facility has it set up. So if there's a clinic type room in each area of the housing, then you perform your duties at that time. If it's a very plain and basic room that different people are able to use, whether it's psychiatrist or other professionals that need to go and speak with them, you may have to carry your belongings with you in a cart or a bag or something to that area, perform said duties, and then make sure you have everything. You do have to be very cognizant of anything sharp. You can't bring cell phones and things in to the jail or prison systems. And it's a different type of environment, but there's rules set in place to keep everyone safe.
Well, Patty, you've worked in so many different settings, each with its own culture, pace, and expectations. When you look back on your journey of 17 years, what do you think all of these experiences have taught you about what it means to be a nurse?
Just hearing you say that gives me chills. I think every experience has helped me hone my practice, has helped me understand what it means to be a nurse and look at each individual as a whole. Limitations, understand that people have psychosocial things going on, they have stressors, they have underlying health conditions, they have life experiences, and you have absolutely no idea what each person has gone through, what their limitations are, what they're struggling with, what they're stressing out about at any moment, despite being in the hospital, being stuck at home, being in a correctional facility. But I think every role that I have taken has helped me understand people and their knowledge of health and how to really meet them exactly where they are. And that insight of how things affect us as people helps me connect with my patients as well as helping them focus on, the problem at hand or what we're there for. But I think all in all, it's really just helped my practice and understanding what to look for, signs and symptoms, how certain behaviors can mean different things to different people, and to really open up that conversation to speak to people and say, I noticed this, and then ask more questions. And you learn to connect with people faster. You learn to connect with people on different levels. And it means a lot to a patient when a nurse says, I've been in that bed, or I've been stuck at home, or I understand what you're going through because I've been there. And I think that all in all, each role I've taken has helped me with my clinical skills, with my assessment skills, with, like I said, connecting and doing so quickly. And really letting people know that we're here to help.
So, for LVNs listening, or for students who may be considering vocational nursing, what advice would you give them about building a career that's flexible, fulfilling, and aligned with their strengths?
I think anyone who desires to become an LVN should understand the roles of an LVN in their city or state because each state has different scope of practice for LVNs, and each community kind of handles LVNs differently, and that tends to wax and wane as well. So understanding that in some areas, your role may be limited to long-term care facilities, home health, things like that. And if your desire to be a nurse is to work in the hospital, what are your next steps? What is your end goal? Because there's absolutely nothing wrong with being a home health nurse, a hospice nurse, working in LTAC. I love wound care as much as I love cardiac care. And you have to know what you love to do and what you're willing to do because if you live in Houston, driving around isn't always as fun. Um, but if you live in a more rural area, there may be more hospital opportunities and they may utilize LVNs. I worked in a hospital that utilized LVNs in a care team format that we worked directly with two RNs and we managed two of each of their patients. And it was a very fulfilling experience because I got to spend a little bit more time with my patients. I got to help meet their needs. And I also got to work directly with an RN and learn and grow with them. And I would say to anybody that wants to be an LVN to understand if it's a stepping stone or if it's your goal, understand limitations and scope of practice and what roles are available in your area.
So, Patty, I want to thank you for sharing your story with us today. Your journey is such a powerful reminder that nursing is not just one path, it's many. And LVNs are essential in every corner of healthcare. Your experiences show just how expansive this profession can be and how much impact one nurse can have across so many settings. Thank you for the work that you do, and thank you for being here. This is Why We Nurse. Follow at Why We Nurse on Instagram and Facebook for more conversations that matter. Until next time, stay curious, stay compassionate, and remember why you nurse.